So my name's Cheryl Haswell, and I'm the nurse lead for recruitment and retainment here at GHC, working with the recruitment team.
My name's Helen. I am a research support officer. I work at the Focus Research Centre at Cheltenham General.
So I'm Laura Whitcomb. I'm an occupational therapist and I work as an integrated respiratory practitioner in the Gloucestershire Respiratory Service.
My name's Sam Lonnan. I was the infection prevention and control team lead before I then moved into the role of decontamination lead.
We weren't testing for COVID at the time, but I had all the signs and symptoms of COVID sort of mid to late March 2020. And at the time we were nursing COVID patients in the community hospital where I was a matron.
I caught COVID in May of 2022. I had general symptoms. I think nothing too major, flu-like muscle aches, fatigue. The fatigue was the worst thing. Breathlessness.
I caught COVID right at the beginning of the pandemic. So I couldn't remember the date because it was the date before we went into the first lockdown. So it was Sunday, the 22nd of March. And my friend that I was living with at the time, still works in the hospital, and she had come home on the Friday before with a cough and a temperature, and I caught it a few days afterwards, unfortunately. Sort of fatigue, very sort of flu-like feeling. I had quite bad tension headaches, a sore throat, nausea, very, very weak, needing to sort of sleep a lot.
It was very early in 2020. It was towards the end of March. So within the first 3 months, I think it was probably about the 23rd of March, I was actually in the control room and I didn't feel particularly well, but I didn't feel unwell. I just didn't feel quite right. And one of the people there said, "Oh, Sam, you don't look very well at all. Are you okay?" And it was as sudden as that, really. One moment I was feeling fine. I think it was probably about 1:30, 2 o'clock in the afternoon. And somebody took my temperature and it was 39.5 or something, which obviously is very high, and said, "Right, you need to go now, this moment." So I quickly left, drove home. Again, I didn't feel particularly unwell. There was no cough, no cold, no signs or symptoms.
But then I had COVID again in 2021 and in 2022, despite being fully vaccinated and taking the earliest opportunities to have those vaccines.
I think after I had COVID, after I'd recovered from COVID, I had maybe a short period where I didn't feel too bad, although I had this fatigue that felt like it wasn't going away. And I think over time, over the next couple of months, the fatigue just got worse and worse. I had a period of a couple of months where I really didn't know what was happening. I didn't understand long COVID. I just knew that I had this overwhelming fatigue that was impacting my life and I didn't quite know how to deal with it. And another new one is shortness of breath. I never had shortness of breath until probably a few months ago. A whole host of symptoms like I think we all have, really.
I've had this experience of a week in sort of thinking that I was starting to get a bit better, and then a couple of days later was completely floored and felt even worse than I did at the beginning of when I was infected. And then I went back to work and just thought, like any other bug, I was starting to get better. So I was walking to work, started to go on some walks outside of work, do some exercise videos. And I think it was sort of after Easter then that I started to feel quite unwell again, and, you know, quite breathless as well, quite wiped out, and really, really just didn't understand what was going on. I used to go into work every day just feeling really, really unwell, really, really run down, really poorly, really achy, and couldn't really understand sort of why that was, you know, continuing. And it got to sort of February 2021 and I was just sort of housebound by this point and really, really struggling, and got sort of signed up with the Bristol Chronic Fatigue Clinic that my GP had referred me to, and they just said, "Look, you just need to go off work now." And I had 2.5 years off that it took me to sort of get to a point where I could return.
But unfortunately, instead of getting better, I became progressively more unwell, and so unwell that I did end up calling 111 and then they sent an ambulance out to me. They treated it very seriously indeed. I hadn't really had anything to eat or drink for probably about 36 hours at that point. I wasn't able to eat. I just had no appetite whatsoever. Even though I knew I should do, I just could not bring myself to. And hours and days just sort of slipped by. They hydrated, they gave me a bag of saline, they gave me painkillers because I was in significant pain. They gave me IV paracetamol and then sent me home again. The same thing happened again. They gave me painkillers, they gave me fluids, they gave me an antiemetic because I was being violently sick every time I tried to drink something, and gave me IV paracetamol and sent me home. I felt much, much better for about 5 or 6 hours, but then it was a rapid descent into being terribly unwell again. This time I think I lasted about 18 hours, and this time they did whisk me back in, kept me back in, and that was in Worcestershire Royal, where I was admitted to the COVID ward. And slowly but surely I began to get well. I got back to work for a phased return. It was a 1 day a week, and then it was 2 days a week. And each time I came into work a week later, I thought to myself, what on earth was I thinking coming back to work last week? I was in no fit state whatsoever to be here. And I felt like that for probably 6 or 8 weeks. Each time I'd look back on the week previously and think to myself, I shouldn't have been here really. I should have been getting well again.
By going to the GP, there wasn't a long COVID service at that time set up. So I went along and had the investigations the GP put in place, chest x-ray, referral to ENT, to have a nasal scope, all those sorts of things. So I got referred on the right pathways that sort of addressed the major issues, but none of them addressed the fatigue.
So I kept phoning the GP. I was told it was multiple things. I was told I was probably having symptoms of the menopause. I was told I was depressed, all manner of things, and nothing that helped me come to the conclusion that it was long COVID. But I think from that point, from probably July, I was thinking, yeah, you know, this could be what it is.
I had like endless calls with the GPs who, in all fairness, were like, yeah, we just don't know what it is, what to do. And I had to push to be referred to the Bristol ME survey.
I went through the Working Well process where I had a number of interviews with one of their consultants.
Yeah.
I had bloods taken at my GP surgery, and they found out that my folic acid was virtually non-existent. So I was prescribed a high dose of folic acid.
The first time it was formally mentioned to me was at my Working Well appointment in August. That was the end of August, and the lady said, yes, she said, you've got chronic fatigue syndrome, stroke ME, which is due to long COVID. And it was like a eureka moment. It wasn't until January when the long COVID clinic confirmed it then again, and then my GP sort of listened a little bit and was like, right, okay, yes.
I actually managed to get an email from them and send it to my GP practice, and then of course once they realised that they would support me, they referred me, and yeah, it was them that gave me that diagnosis. And after the first assessment with them, you know, they'd written out like a proper, you know, letter to my doctor that sort of detailed what was going on with me, and I think it helped just to get that little bit of validation and support around that.